You may have heard the expression, no hoof, no horse. My name is Ellie Williams, and I want to share some information about the structure of hooves, common hoof ailments, and proper hoof care. First is anatomy. The heel, the quarter, the toe, the bulbs, the central sulcus, the angle of the wall, the bars, the collateral sulcus, the white line, the apex of the frog, the wall, and the sole. Then there's the long pastern bone, the extensor tendon, the coronary band, the lamina, the coffin bone, the hoof wall, the sole, the frog, the navicular bone, the digital cushion, the short pastern bone, and the flexor tendons. The wall, bars, and frog are all weight-bearing structures. The frog acts as a shock absorber and is also part of the circulatory system. The bursa is a fluid-filled sac that decreases friction between the navicular bone and the tendons. Ailments. A few common hoof ailments are thrush, podomatus, white line, onychomosis, abscesses, and founder laminitis. Thrush is a fungus caused by damp or dirty stable or pasture conditions. Thrush affects the horse's frog and can be prevented by regular farrier care, hoof cleaning, and good stable management. White line. Onychomosis white line is a fungus that thrives in a warm, moist environment, provided by the space underneath the hoof wall, and attacks the stratum medialis and digests the membrane responsible for securing the hoof wall. White line disease can be prevented by regular hoof care and proper stable management. Having your horse seen by a farrier every 6 weeks will decrease the chances of having a separation between the sole and hoof wall, which allows the fungus to enter the hoof. Keeping your horse in a dry environment can also decreases the likelihood that the fungus can enter the hoof capsule. Abscesses. Abscesses occur when microorganisms, bacteria, gain access to the hoof. This happens when there is a separation between the hoof wall and sole. Also when there is bruising to the hoof. Abscesses normally occur after long periods of rain. The best way to prevent an abscess is to care for the hoof and have a farrier trim your horse's hoofs regularly. Founder. There are two types of laminitis, founder, mechanical and metabolic. Both cause damage to the lamina. Researchers think that metabolic founder is caused by constriction of the veins in the hoof, slowing blood flow through the capillaries in the foot's lamina. Mechanical laminitis is caused by repeated impact on hard surfaces or by bearing too much weight on one leg while trying to keep weight off of another leg, as often happens when a horse is injured. Hoof care. Having a qualified farrier care for your horse's hooves every 6 weeks is the most important part of hoof care. A close second is proper nutrition. You should always seek the advice of a professional such as your veterinarian or county extension agent to determine your horse's nutritional needs. Lastly, you should clean and inspect your horse's hooves daily.